Hello everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And today's guest is Dan Chavez. He's the executive director of the Santa Cruz HIO. Welcome, Dan.
Thanks, John.
Yeah, so I'm excited to talk about, Health Information Exchange, identity management. We're at the Civitas conference. That's also, DirectTrust is here as well. And so there's lots of conversation going on. But before we dive into that, tell us a little bit about yourself and the Santa Cruz HIO.
Thanks, John. I'm new to the Santa Cruz HIO. I started this position in March of this year. But prior to that, I've got 4 decades of HIT experience.
Wow.
And relevant to HIE, I was employee number 4 at Verato We, and I started the San Diego HIE and ran that for 8 years. So that's my experience. I've been a Verato customer in the past. In fact, I was the first healthcare customer for Verato.
Interesting. So that was the recent announcement that you decided to partner with Verato to help with your identification problems. Tell us what went into that decision.
Well, without question, identity is foundational to health information exchange and interoperability. You can't exchange information unless you properly identify. And to date, we had an integrated identity technology in our HIE stack. And in all candor, it wasn't quite meeting muster. We needed more, especially as we evolve and expand our services and take ourselves from an HIE to an HIO to a health data utility. So we needed more granular, finite, manageable identity. And that's what Verato is going to provide us. As you know, we learned a lot from the pandemic. We need to do a much better job of figuring out who people are, where they're at, and what they need, specifically as it relates to race and ethnicity, to identity, to sexual orientation. So to date, we probably haven't done a really good job of capturing some of these attributes. And so this is that next level, to really have us do a better job of taking health information exchange for greater equity and access in its service offerings.
So give us an idea of what some of the identity challenges are. Are there some example use cases or experiences you have? Because I think people don't understand how challenging it is.
It's tremendously challenging. Let's take my name. You called me Dan Chavez. My mother named me Daniel James Chavez. But is it Dan? Is it Daniel? Is it Danny? Is it Daniel James? Is it DJ? Right? And I'm a male, right? We have hyphenated last names. Males have hyphenated last names now, but is the last name before the hyphen or after the hyphen, right? A variety of ethnic last names. Females, maiden name, married name, divorced name. So there's a whole history that goes into identity, and it changes. We need to respect that, we need to honor that, but we also have to capture it, because identity management is key to providing good health care and wellness services.
Yeah, absolutely. Well, I'm a John, so Jonathan.
Yeah. Right, J-O-N.
H without it.
Yeah, exactly.
Exactly. I understand this problem, but has it become more complicated now as you kind of described HIE to HIO to data utility? You're adding new services and things like SDOH data. Has that made the identity problem more challenging? Maybe because some of those SDOH sources don't have the same identifying factors, or how does that play out?
No, exactly. Not just the sources, but also the intake and where we share it, the destinations. A couple points. So as HIEs evolved, they have greater service offerings. So now we're in EMS. We're more into public health. Let's take the pandemic, for instance. I often ask, John, do you know for a fact that your COVID lab tests and your COVID vaccinations are part of your primary care medical record? Most people will say, no, I'm not sure they are or not. Well, one reason they're not is because of the identity problem.
Yeah.
We went everywhere we could to get tested and to get vaccinated.
Yeah.
But then getting those records back into our primary care medical record and having that information available to us at the point of care has been a challenge. One big challenge in that process, identity.
Yeah, that's
right?
true.
As we expand more into EMS and getting service real time on a street, we've got to be able to do the identity management thing as fast as possible if people can share with us and get them that information as close to real time at the point of care, perhaps even on the street.
Yeah, but if you solved the identity management problem, I wouldn't have to fill out those long forms. I mean, I would really, just kidding.
No, but certainly that's also true.
That's
right.
the goal, right?
No, exactly.
That's the hope.
Right, and then also have you manage your identity for the healthcare ecosystem, right? Versus doing a paper form every time you have a visit.
Yeah, absolutely. I think all of us would be happy if we could, improve that problem, not just because we don't want to fill out the form, but also we want to improve the care that we receive.
Absolutely.
Whether that's SDOH data or vaccination records, whatever it might be.
Absolutely.
So talk about it. I mean, you mentioned this shift, which I think is interesting, from HIE to HIO to health data utility. How would you define that evolution, and how would you define the different categories there?
Well, you mentioned it earlier. So healthcare has a pretty defined process. When you come in, Dan Chavez here for his 11 a.m. appointment. My driver's license, my insurance card, validated. But as we go to more expanded services, whether it be EMS or some of our social determinants of health with social services agencies, community-based organizations, they don't have that defined process. Not to mention they may not have the systems to capture the answers real time. But with a simple query to the HIE with a variety of mechanisms, we can validate that real time. So we want to expand more services, provide service provision much easier, simplify it way outside the medical or the clinical setting, and this is just all part of that process and part of that evolution. Give people a handheld app where they can manage their demographics, where they can manage their consent, all part of that process. Simplify identity proofing. Let's validate that John is who he says he is, right? Make that as simple as possible.
Yeah, it seems like the other thing that's maybe causing a major problem here is the fact that I'm getting care from a lot of different places.
Yeah.
I may go to Walgreens because it's easy and convenient, or I may go to telehealth because it's easy. And now, all of my data, I may go to GoodRx and grab the cheapest prescription, right?
Absolutely.
So all my data is spread across all these. So is that part of the problem too, is that we don't just go to our primary care doctor and then for all of our care?
Absolutely. And the pandemic taught us that. We're going to go someplace that's convenient, right? Efficient and fast.
Yeah.
And I do that poll, do you know, right? And so many folks, and then take a family, and a family may have 3 children in 3 different schools, where they've gotten care at 3 different schools. Now, as you look at being a parent, right, trying to aggregate that information, right, is a challenge.
Yep.
And so there's also those relationships with caregivers, with parents, with family members, with paid for caregivers, to making sure we can do that identity process across that whole care schema.
Yeah, absolutely. Well, as someone with 4 kids that had to go into the pediatrics to get the immunization record, when actually they could have just given me a portal and they didn't tell me. There's an education component here too.
Absolutely.
Yeah, well, this was an exciting discussion, an exciting partnership with Verato to kind of address this identity management. So thanks so much for sharing, and thanks everyone for watching and listening.
Thank you.
If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com. Thanks.
Thanks, John.